Then you have non-inferiority. This is very interesting study because you allow you to compare two treatments and say, we would like the new treatment to be better, of course. But even if this is worse than the standard of care a little, but just a little, within some margin, we accept this. This will not work for placebo because the placebo does nothing. So you definitely don't want your new treatment to be worse than placebo because it means that you are harming patients because they
Exactly.
deteriorate over time instead of improving or doing nothing. But non-inferiority is typically used for studies for treatments that are already accepted in
Mhm.
use, and you introduce a new treatment and you want to be better or no worse by some margin, within some margin of being inferior. This is acceptable.
Mhm.
Why do we do this? Because, for example, your new treatment is easier to administrate. For example, you don't need to do any injections, you need to just swallow a pill, or it has fewer adverse events, or is cheaper,
Mhm.
has fewer bad reactions or interactions with different drugs. So
Mhm.
there must be some other benefit. So you agree that you may be just slightly worse in what the drug actually does, but it must have another benefits. So
Mhm.
then you agree on being non-inferior. And so we have three: non-inferiority, superiority, clinical superiority, and equivalence.
Mhm.
Equivalence, it means that the new treatment is neither worse nor better. It's
Mhm.
exactly within some range. So
Yeah.
the two treatments are within some range of equivalence. And this is used for generic treatments. So when you have some, for example, patented formula, and then the patents, you found a new molecule, for example, and you just want to prove that your treatment, your generic treatment, is equivalent, is neither better nor worse. But to know this, you need to know the margin of equivalence, and this is the clinical importance. So the clinical importance in clinical superiority is the non-zero value that you must be better than this. In non-inferiority, the clinical importance is the acceptable margin of being worse, no more than this. And in equivalence study, this is the margin within you say that you are equivalent to the actively working approved treatment.